Good evening, everyone, and thank you for joining us. Rod has the night off. September is National Suicide Prevention Month, and a big part of that is focusing on mental health. According to a study by the CDC, teenage girls are more susceptible to mental health issues. Channel 8's Annie Elming spoke with a mental health expert today and joins us live in studio with more. Annie?
Mental health is a common theme among teens and preteens, and girls are statistically at a higher risk of suffering from these issues. A recent report from the Centers for Disease Control and Prevention found that in 2021, almost 60% of high school girls in the U.S. had persistent feelings of sadness or hopelessness.
The images that they have on all of these things tell them they should look a certain way, dress a certain way, be a certain way. And for girls, that's incredibly difficult because maybe they aren't that way genetically, and they aren't that way because of finances, and they aren't that way because those things are all photoshopped.
Dr. Waldren with Bryan-Counseling Center says there are certain warning signs to watch out for that can indicate if your teen is struggling with their mental health.
If their behaviors change dramatically, so you can be a little quiet, you're down, you got a bad grade on a test or something like that, that is something that is part of the norm. But when their behaviors change dramatically, when you're seeing something different, they're not eating the way they always have, they're not engaging in regular activities.
It is also important to regularly communicate with your teen and be someone your teen can turn to if they are struggling.
We are also teaching them to communicate, how to talk to one another. So if we don't talk to them, they don't learn to talk to others.
Parents, along with trusted teachers and school counselors, can be pivotal in helping a student with their mental health, and it is always advised to talk to a trusted person if you feel like you are struggling. Dr. Waldren also says medicine and clinical approaches to mental health can be good resources if any issues persist.
Annie Elming, thank you very much for our top story tonight.